Dear colleagues, I offer us to start our meeting. Greetings, everyone. Very glad to see you today at our meeting of the Technical Working Group on Mental Health and Psychosocial Support. That is our final meeting this year, and we are going to draw conclusions of our work, and we are going to discuss what we've been doing, what we've been prioritizing this year. And I truly hope that today we will succeed also to hear some feedback from you and maybe some reflection and some thoughts, because it is also very important for us. But we will try to create also some other conditions, other possibilities for that, because we do understand that it's the end of the year nowadays and maybe not everybody could join us. Actually, from organizational point of view, I would like to remind you that this Technical Working Group on Mental Health and Psychosocial Support on the national level is chaired by the WHO Office in Ukraine International Medical Corps, together with Coordination Center for Mental Health of the Cabinet of Ministers of Ukraine. We have two working languages, English and Ukrainian, and you can use the simultaneous interpretation function if you press the globe button in Zoom's interface. In addition to that, we are asking you dearly to present yourself in the chat and mention which organization you are representing in order for us to be able to include you as participants to the minutes of this meeting. And also, regarding the minutes, we ask you not to use the tools of making notes that is done by AI, because we are making our own notes and we are sending the minutes after the meeting, and we are also sending actually all the materials that participants are sharing and all the presentations. We are sharing all of that right after the meeting as soon as possible, so we will be very grateful for your understanding in this regard. Well, actually, now the program is such that, according to our agenda, as you know, we have the meetings in the format of discussions and meetings in the format of briefings. So today, according to the schedule, we have the discussion, but as far as it is the meeting to sum up everything that we've done during the year, so we want to dedicate that not to discussion of a certain topic, but to discuss instead the summary of our work, to draw the line, before next year we will plan our work already for 2026. Traditionally, in order to tell everything you in a structured way and to sum up our work, we are using our key framework developed by Interagency Committee. That is the handbook dedicated to coordination of mental health and psychosocial support, according to which the technical working groups and actually this platform, we all have 7 key actions or functions that we are implementing. Well, and actually these functions are supporting the technical working group's operations, information management, establishing links between different stakeholders and interested parties, monitoring and evaluation, then building capacity, knowledge exchange, and promoting long-term sustainability. Well, actually, today I am going to build my speech and my updates in this format, and we will go through all these key actions, and I will tell you about what we've been doing in different aspects in this field. So I will start with information management. As you all know, one of the key updates for us this year was that we updated the referrals map of the technical working group, and we took into account your recommendations. As you know, the technical working group is performing this function for quite some time already, and even before the beginning of the full-scale invasion. We've been working on mapping, and we are improving that all the time. Of course, we do understand that it's impossible to have the perfect tool, but altogether with that, we are so grateful to everyone who is sending us feedback and is helping us to see that all the information on the map is accurate and that the map is convenient as a tool and that we can actually all use this tool. in our work. And here you can see to the left such a timeline, right, how our mapping was developing. And we can see that in comparison with 2021, when we had totally different response, and in 2022, even if we compare with 2022, the coverage of services is growing. We see that most regions of Ukraine, they have information about different service providers, and actually now on our map there are services in more than 1,000 communities represented, and we are showing these services from more than 100 of organizations. And not just the quantity, but quality is also important. And this year we reviewed and contextualized the list of our types of activities, that is the list of services that the organizations can mention that we have on our map, and we have twice less activities in comparison with previous years. But we think and we hope that you share this opinion, that these services are more in line with the activities of our partner organizations. We've been actively working with you and different stakeholders in order to make this tool accessible, and also we have used the information provided by you in order to make this update of the map more regular, because it has to contain the information which is relevant, up to date, and therefore we cannot allow ourselves to have some data there that are outdated, right? And that is why this year we have launched the process thanks to which the map is updated on the first day of each month. And thanks to that, you can receive the most relevant data. Of course, if you still have some additional wishes or comments, we are always open to that, and you can actually use the map itself, and you can press the button send feedback, because we are really open to improving this tool. And also in the framework of our reviewing this map, we've added the mobile version of this tool, and we've been trying to make it as accessible as possible so that you can also use your phone to take a look at that if you are at different places and you need the information from the map immediately. We are really open to receiving the feedback, and we truly hope that it is useful for you. If you are talking about establishing links between stakeholders and about work related to our big networking that nowadays has approximately 450 organizations. You know, in our coordination chat this year, the number of participants exceeds 3,000 already. So we've been also working on optimization of our regional structures, and this year we focused on those regions of Ukraine that nowadays are, well, humanitarian response is focused there mostly, and those that have most challenges related to war. And accordingly also we continue working on this regional level in Kyiv hub, and Eastern hub, and Southern hub. And we continue this work in spite of certain limitations related to the fact that some organizations have stopped the financing. Well, there is lack of financing, or there were many subnational structures in different clusters. They were closed and reviewed. We are still very happy that we managed to preserve these 3 hubs, and they continue functioning, because we are discussing very important aspects of providing services in locality there. And also we had very good news related to the fact that 4 of our groups during this year and last year, they came, and now they are working under the leadership of local self-governments, that is Lviv, Zakarpattia, Chernivtsi, and Vinnytsia regions. These are the groups that were created as the first ones to respond to the full-scale invasion in 2022. And now the situation is more stabilized there, and still local authorities and local coordination structures, in particular coordinators from Ukrainian program and mental health, well, they are coordinating the activity in these regions and also the needs, they are really not that acute. So we were very happy that they came under the leadership of local authorities.
Of the local authorities. So right now we continue supporting other more affected regions, and we continue helping regional coordinators to implement the high quality work there, and we are very happy for this development happening in the western part of Ukraine. Apart from that, we have one more event, one more new aspect among our task teams. I think that a lot of you have been for a while with us and you attend our meetings very often. You know this scheme, the organigram of the technical working group on MHPSS. So we have not just the regional hubs that I mentioned in the previous slide, but we also have task teams. And before that, we had 4 task teams dedicated to psychological interventions, and also the task team on mhGAP, implementation task team on MHPSS in education, and task team on MHPSS for veterans. And this year, our family got bigger, and one more task team joined our family dedicated to the mental health centers implementation. Since this is one more platform where we need the partner's support, and it is prioritized by the state, you know that the network of these mental health centers is actively developing in Ukraine, and we said about it in our previous meetings. That's why we're so happy that one more platform, one more task team joined our family, and I encourage colleagues for whom this area of activity is relevant, please join this task team. To do that, feel free to contact our technical working group, and on the national level, we will inform you about everything. Of course, this year we continued the cooperation with the clusters and the teams of humanitarian coordination. Humanitarian country team, you can see it here above. And of course, we tightly cooperated with the health cluster, production cluster, education cluster, and all the other teams of humanitarian coordination, in particular with gender-based violence and child protection team. And probably you remember even previous meeting, colleagues working in Mine Action joined us, since it's one more priority area of work for the technical working group, because last year in 2024 we saw some gaps in the service coverage in this sector, and this year we tightly cooperated together with our colleagues to fill the gaps. Apart from that, it is so important for us as for the technical working group, and especially for us as the co-heads of this technical working group, it's important to understand our audience. And as participants, we also need to understand who is a part of our network, who we cooperate with. That's why this year we also ran a survey among the participants to understand what categories of organizations they belong to, and we understood that we have the following distribution. We received almost 300 answers, and we can see that right now we have both the organizations which are NGOs, and also we have international organizations, state organizations. Technical working group platform is very diverse, and this is our strong strength, because actually I think everyone can see that, especially when some questions are brought up in the coordination chat in the Telegram, then most of these questions get the answers, starting from providing specific support to specific groups of service users, all the way up to specific tools and recommendations to specialists, well, and so on. I think our strength is about the fact that we have really diverse participants of our group, members of our group, and members of this platform. So if we look at it from a different perspective, not just listing different types of organizations, but if we try to see the percentages, how many national MHPSS actors we have and international ones. And according to the latest calculation, more than 60% of people who are the members of our technical working group are the representatives of the national MHPSS actors. So I understand that this statistics needs to be provided with the specific context, because from the very beginning back in 2022, we had about 25% of the national MHPSS actors. Mostly there were international organizations that right away responded to the war in Ukraine and joined the response and management. But right now we can see an absolutely different picture, and this percentage in almost 4 years has significantly increased. I mean, the percentage of national MHPSS actors, and I think it shows our strength and the importance of our work. Apart from this fact, if we speak about the distribution between the national providers and NGOs and private actors, so more than half is governmental actors, but also different actors representing the non-governmental sectors here and private practice. Here we may have a few answers. I mean, the participants could say that they work both in private practice and in the other sector. This way, we had a chance to receive such diverse answers, but this statistics is so important to plan our work for the next year, and we'll also discuss that shortly. Well, what we do as the technical working group has to meet the needs of all the stakeholders represented here. Now, in terms of the activities of all these organizations and the members of the technical working groups, so this year we have the following statistics. If we divide the activities by the pyramid levels, like when we go up, the representation with organizations goes down. So with each level, the services or activities get less popular, and that's clear and absolutely understandable. Level 1 activities, basic services related to social considerations and securities, almost 95% of organizations told us that they provide some services on level 1. At the same time, level 2 has 92% of organizations, level 3, 89% of organizations, level 4 is 41% of organizations. So less than half organizations on the map provide services on level 4. So we can see that we have very even distribution, in my opinion, of the services, but also, of course, more specialized services are mostly provided by the governmental sector, and it makes sense that we have these statistics. In terms of monitoring and evaluation, as the technical working group, we also analyze the number of people receiving the services. According to the reports they send to different clusters. So you can see the statistics here, and this is the preliminary statistics, since not all the clusters have finished data collection and data processing over the year, and we expect to get the final coverage results to be a bit higher. But anyway, this year we covered, according to the reporting on the platform activity info, more than 2 million people. In particular, partners who are in the protection cluster, they covered the biggest number of people, 2.1 million people, 670,000 were covered by child protection, 461,000 people were covered by general protection cluster actors, and almost 100,000 people received the services from GBV area of responsibility actors. Of course, health cluster and their partners covered almost 800,000 people, and the education cluster covered more than 350,000 people with their services. So the topic of mental health and psychosocial support is a cross-cutting topic. It is still relevant, remains to be relevant among different clusters, and we can see that the services provided include not just the health sector as we know it, and not just the protection cluster and sector, but also other sectors. At the same time, let me remind you that if you want to read more about how to report to the technical working group, you can find this information on the webpage. If it's relevant for you, it has to be relevant for all of us, because thanks to this information, you can make the conclusions about the gaps in our work as actors of MHPSS, and we can also analyze different achievements, identify what needs to be improved and what we need to pay more attention to, and so on. So Irina right now will put the information in the chat how to report to different clusters. If you want, you can provide this information if the reporting is still open, but you can also provide this information next year because it's really important. Moving on to building capacity, knowledge exchange, and peer support. It's one of our core actions. Of course, this core function, this core action is historically core function for us because we know about a lot of needs in the education area among service providers. I mean, psychologists, social workers, volunteers, and anyone engaged into the response. But at the same time, it is important for the beneficiaries, and the training of the service user is important for us as well. Of course, it's important not just to build capacity, but also to exchange best practices, knowledge, and to cover and focus all the achievements that Ukraine has and continues creating. That's why this core action is the priority for us and has been the priority for a while. One of the key findings in this area in our task team activity is the strategic mapping of services provided by mental health and psychosocial support actors in Ukraine. So we name it mapping or interviewing that the technical working group ran at the end of last year. And yesterday we had the presentation of the report according to the results of this initiative. Let me remind you that it's a huge initiative that we implemented where we ran 80 interviews with different organizations. I mean, 80 different active service providers were interviewed. Those organizations, which are the members of the technical working group, and they were asked to share their MHPSS implementation experience, the challenges they face, to tell something about their innovations, barriers, achievements. They were really in-depth interviews, and we really want to thank all colleagues who joined this initiative. And I can see in this meeting the participants who participated in that initiative, which is very nice. So according to the results of all this data analysis, we issued the report, which includes a lot of everything that we discuss in the technical working group. And for a long while, these points are important for us, but also a lot of new aspects were mentioned in the report that probably we need to pay more attention to next year as well. So all of that is dedicated to the use of the word trauma and trauma-informed approach, and they are dedicated to the qualification of psychologists and the tasks psychologists have, and response in MHPSS and response out of humanitarian sector. Also in this report, there is a very interesting description of different innovative activities and aspects and points, and about tension in Ukraine related to the fact that some organizations are more prone to implement standardized services and other organizations prefer more eclectic or more free format service provision. Also, very interesting results were about how these 80 organizations participating in this initiative, how they see and perceive the correlation between Ukrainian local experience, local knowledge, and the correlation with the international best practices. I think that it's very important and interesting, and everyone can find something interesting and important for yourself in this report. So I really encourage all of you to read the full report and contact us if you have some reflections or suggestions about it. Also, within this package, apart from the report itself, which has data analysis, we also issued a catalog in which describes MHPSS activities of all the organizations participating in this map and interviews. So these are like the business cards or description of the activities and organizations of the initiative. So this report is being translated already in Ukrainian and it'll be available in January or early February. That's why all the participants who want to read the full report in Ukrainian will have a chance to do that. That's why I encourage you to use this tool and also share your feedback. It's a really important initiative for us, especially because it includes the recommendations in particular for the technical working group, what is recommended to do and what's recommended to implement according to the results of this initiative. One more core direction of our work, apart from analytical work and work with documentation of different aspects of response, we're implementing, of course, different trainings. And this year, in-person trainings, we had fewer. We focused more on webinar and online trainings, but next year we're going to and we plan to strengthen the offline training component, I mean face-to-face training component. So this year we had 143 people who finished the offline trainings of the technical work. In the picture you can see the second wave of training on EMDR. This is the initiative and innovation implemented by the Technical Working Group on Mental Health and Psychosocial Support. Last year, in 2024, we trained the first wave of trainees. We had about 50 participants, and this year we continued this initiative and we trained the new wave of participants that includes 70 people. So we increased the number of participants and we continued providing this training, which we believe is one of the priority trainings since it's free of charge for the participants, and the training of this evidence-based high quality, but at the same time, very expensive method to get trained by yourself and to pay for that. Well, it's really important for us to provide the participants of the technical working group, the members of the technical working group, with the access to such evidence-based methods. So it was one of our initiatives. And apart from that, we provided different webinars. And here on the screen, you can see the list of them: the webinar on sensitive communication, the webinars on loss and traumatic grief, about suicide prevention. These topics were prioritized by our technical working group members early in the year. And for these trainings, we engaged international experts who shared the experience of different countries to respond to all the challenges. And I'm so glad that we have more than 3,000 people who managed to join these webinars. Let me remind you that all the webinars are available on our YouTube channel, and Irina has already sent the recording, the link to the recording of all the webinars, and we have all of the recordings on our YouTube channel so that you'd have a chance to watch it. So even if you missed something, we do our absolute best to post all the meetings, all the recordings, and different meeting recordings as well. So about MHPSS technical working group meetings, we had 11 briefings format meetings where we discussed key updates in MHPSS in Ukraine, and 455 members attended them, and also we conducted 6 technical discussions dedicated to different topics that you can see here on the slide. I mean, it's the discussions dedicated to the topics prioritized by the participants, which we identified early in the year as those that need the biggest focus of attention, that have the biggest gaps in Ukraine, and that's why we prepared these discussions, engaging both international experts, national stakeholders, NGOs, and at the same time, I want to thank everyone who joined the discussions themselves and actively participated in them, and who shared their experience, who was a speaker and shared the experience of your organizations and helped other colleagues like learn from your good practices and knowledge. Here we also discussed different topics in the discussion. I mean, countering substance use and suicide prevention and disability inclusion and MHPSS and services, MHPSS services in cases of ambiguous laws, remote MHPSS services, and applying do no harm principle in MHPSS for children and adolescents. One more important point that I'd like to tell you about is that this year we made available a lot of publications. We made a lot of publications available as a technical working group and as the WHO, the organization that co-heads the technical working group. We translate different tools, and here right now you can see the tools only from the WHO, but we also know there are a lot of other tools which became available in Ukrainian language this year. It's psychological interventions and the tools dedicated to the services in the human rights area and tools dedicated to suicide prevention and tests to identify substance alcohol use disorders, which is really important for me because the topic of substance use disorders, including alcohol use disorders, this topic is the priority for the technical working group in 2025, and probably it'll remain to be relevant in 2026. So it's a very important tool which became available. So Irina will put the link to all these tools in the chat right now, and I encourage all of you to use them in your work and to look through all these tools. Right now, I also want to give the floor to our colleagues from task team on psychological interventions, because this is one more key direction, in my opinion. A lot of important activities happened this year, and we plan to have even more activities because, in my opinion, psychological interventions is the direction that everyone needs and that everyone talks about. I really thank our colleagues from task team on psychological interventions for the continuous fruitful cooperation and that you attend our meetings. So to share our points and aspects of work. So Hanna, over to you. Could you share this information? Hanna, thank you. Thank you so much. Hello, everyone. Yes, we really have a lot of updates today, and today we'd like to sum up our activities, but at the same time, I'd like to highlight that all detailed updates and what happened in 2025, like we will have a separate meeting next year in January or early February when everyone comes back re-energized from holidays. We will have a separate meeting about that. That's why today I do hope that I will briefly tell you about it, but it's not all. I will share just general data and figures with you. So next slide, please, out of this data. So I'd like to start from this data. Here we can see the map, the engaged organizations, and today I will thank all the partner organizations that are implementing scalable interventions in Ukraine, especially self-help class, problem management class, individual format, and doing what matters in times of stress. And this year, all of us trained more than 1,000 specialists, and we have 29 partners engaged to scaling up this intervention all over Ukraine. I would like to highlight that I really think our joint achievement is the low level of dropout. So we calculate who came to the training, who signed up for the training, and who actually finished all the stages of the training, including the supervisions and implementation in the field, and who actually finished this training and got the certificate. So 9%, I can tell you that it's a huge achievement of ours. Most people were trained in the social sector, humanitarian sector, health sector, education sector, and veteran sector falls behind, defense sector and private sector fall behind. But at the same time, let me highlight that the social sector is really huge. And even in the global context, it is the main one providing psychosocial services. And of course, health sector is also important. And right now, due to the fact that we have the crisis situation in Ukraine, humanitarian sector works very actively, and we really appreciate that. I hope that everyone has managed to find your logo of your organization. If you haven't found it, please email me and scold me about it if you haven't found your logo of the organization. Let me say a bit more about interventions one by one. So here you can see the training of trainers. This year we trained not many people in the training of trainers format because we think that in Ukraine we have enough PM Plus trainers. 81 trainers are scaling up PM Plus in Ukraine. So if one of the partner organizations wants to join and doesn't know where to find the trainer compliant with all the standards and requirements to implement PM Plus in Ukraine, please contact me. So here you can see the most active organizations engaged into scaling up of PM Plus, and over previous years and this year, we engaged into scaling up of PM Plus 42 organizations on individual format of PM Plus. Next slide, please. This year, we launched group supervisions and trainer support on individual PM Plus format, and we created the professional community. So 37 PM Plus trainers who actively implement this year and continue implementing the intervention training others all over Ukraine. They actively participated in 3 offline 2-day supervisions. It was not our decision, I would like to say that it was a request last year of trainers who were certified according to PM Plus to create this trainer community and to continue supporting the trainers. So that's why group supervisions were created, and next year we will continue providing group supervisions. There will also be 3 offline 2-day supervisions in Kyiv, and we will continue providing individual supervisions upon request. So please, among the trainers, if you haven't received the individual supervision, please join us. The aim of this community was to build and support the trainers to ensure high quality services and the compliance with the requirements and standards of PM+. We understand that PM+ has reached the national scale, and we need to continue providing the support for the trainers and partner organizations, which continue scaling up PM+ and working in this regard. So what is it that we do? Over this year, I can say that we fully adapted and integrated EQUIP, and I mean the quality assessment tools for this program. That's why our trainers already have this practical experience how to use EQUIP tool in the work and training on PM+. I can tell you that right now this is the only practical experience that works, that is adapted, and we, as you said, Katerina, we created the catalog of organizations, and we have the flexible approach in Ukraine and our context. Next slide. Here you can see the summary, general summary. So right now we have more than 1,000 PM+ consultants that covered with the training. Luckily or unfortunately, not to torture everyone with reports, we covered more than 2,000 people with trainings, or almost 2,500 people received not just the service, but also improved functioning and reduced distress. Here you can see the implementation results. They are average. These indicators are average because in our program we measure and we have the scale of distress and the scale of functioning. Let me remind you that PM+ program is for those who have the severe symptoms of anxiety, depression, and PTSD. We do not take people with low symptoms or mild symptoms. So the average indicator was 75 by distress scale from the very beginning, and it went down to 32%. That's about distress, and it went down to 28%. We could see the improvement of the functioning by 47%. So let me tell you that this is the reverse scale. I always forget to say that because I'm a technical person and I know that all our consultants and trainers understand and know that, but for non-technical people, we say that our functioning improved and we use the reverse scales to measure the distress and functioning, and the distress reduced in contrast to their initial distress level they came with in the communities for this intervention. Of course, it does not reflect the full picture because the real changes may be noticed in real lives of people. Next slide. I would like to tell you that this year we launched an intervention doing what matters in times of stress. And we actually started from a more adaptation. If you've been with us for a long while, you know that in 2021, the WHO started this training. But in 2022, our context changed and we needed to implement more easier interventions. And then we had the transitions from doing what matters in times of stress to problem management, to self-help plus, which was scaled more. And right now we come back to doing what matters in times of stress this year because we can see that it's important. And we heard from our facilitators that we train that those working with people providing psychological care and support, for them it's also important to develop more. They want to be more engaged into facilitation and they want to see the changes in the interaction more. Doing what matters in times of stress works just as well as self-help plus. The only thing is in self-help plus we didn't measure the improvement which was happening and we tried to train as many people as possible to have these skills. But here we managed to measure that. And the only thing you can see that in contrast to PM+, we didn't select people with high symptoms of distress or very low functioning. So here you can see that the improvement in contrast to PM+ will not be significant, but for real, it is significant. And this year, together with the partner organizations, I will move on to the next slide. We trained, but it's not full data yet. So we trained to more than 100 facilitators. And this year we conducted the first training of trainers for 15 trainers from different organizations, ICRC, UNICEF, Dorcas, MDM, Rokada, Taras Shevchenko University Medical Team, 10th of April. And we really want to thank you for that, because right now these trainers, they continue training facilitators and they conduct the sessions themselves, training sessions. So I want to thank all the organizations which got inspired. And I think once I heard from a psychiatrist that doing what matters in times of stress is one of the interventions that I implement and get inspired with, because it's about the values, it's about some profound definitions. Next slide, please. I would like to highlight that right now we transit into the new year and we will continue adapting ease. It's easier for us to use the English abbreviation. Here you can see the QR code, and Katarina has said that right now this handbook is available in Ukrainian, but if you read this handbook, it doesn't mean that you can run ease groups. Just like with any other intervention, you need to finish the training. I know that there are so many questions. When can we participate in this ease training? Right now, this intervention, and yesterday we had a separate meeting dedicated to it. Right now, we're adapting this ease intervention in cooperation with our support from the WHO. UNICEF is piloting and implementing it together with the Coordination Center for Mental Health and us. And this ease intervention is used to help this category of teenagers in the age group 10 to 15. And I can say that it is very difficult to cover this audience, because when we work with the teenagers, especially, we have high level of dropout from the sessions, and it's really important to work with the parents. So this intervention is very similar to PM+, because it also uses 4 strategies: stress management, behavioral activation, problem management, and emotion identification. The only thing that makes it different is that there are a lot of different tools which are also available apart from the workbook for a teenager, the workbook for the caregiver or parent. And also there is the storybook compilation and pictures which are used within this 7 group sessions lasting 90 minutes for teenagers, and there are 3 separate sessions for parents or caregivers. According to the results of the pilot project, UNICEF shared the results with us, and with the support of the WHO, we plan to share the results of this adaptation, and we plan to have the tools ready, technical package, because the technical package is adapted to Ukraine and it takes a lot of co-actions and joint work. So the facilitators will have a chance to look through this technical package next year in March. So I hope that the facilitators will become the trainers as well. Once again, I want to thank UNICEF and the Coordination Center for the mental health and all the organizations that right now are still waiting because there are some international trainers, and these international trainers are waiting for the development of this technical package, Ukrainian package that is adapted to our local conditions, and to scale up this intervention within on the national level next year. So it was important for all of us to share that. That is an important achievement this year, that this big project started and this intervention was launched. But we hope that scaling up will take place next year. So all the trainings, if you want to take the training, I think that you'll have a chance to ask all your questions next year in the next meetings. Thank you. And one of the interventions that I'd like to share with you is also the WHO intervention. Next slide, please. This is the group interpersonal therapy of depression. The translation into Ukrainian is also available on the official WHO website, and you can look through it. It doesn't mean that you can use it and implement it, because without the specific training, it's impossible to do that. But thanks to IMC, International Medical Corps, with our support and the support of the Coordination Center, the adaptation process has started from December. So right now, the specific number of specialists finished the training, and we will see how it falls into the system, who will be trained, where these people will be trained. I think that we will create a separate meeting on group interpersonal therapy, and we will tell you more details about the intervention itself and how it's adapted in Ukraine, and we will join the global experts as well, and you'll have a chance to ask all your questions in that meeting that will happen, I suppose, in March, when we have the preliminary results. Because in terms of ease, UNICEF shared the preliminary results with us yesterday, so I think that we will have a separate meeting like that together with International Medical Corps, IMC, to share the results as well. It's important to say that, like, despite the fact that this is a scalable intervention, it works with disorders, with depression disorder, with different types of problems, conflicts, change of roles, grief, and here, with the support of the WHO, and the WHO developed the group format of interpersonal therapy, but it can also be used individually and even for teenagers. That's why this adaptation process that continues is so important. That's why please be patient, because if actually it'll get to the national scale and up, like, actually we need to wait for that, because it'll help cover and meet a lot of needs, and it'll be a very functioning tool, one of those functioning evidence-based tools that a specialist can use. The format is 8 sessions, 90 minutes each, very small groups, because these are therapeutic sessions, just like the group format of PM+. Thank you so much. Feel free to ask your questions, writing me an email. I already took a lot of your time, so I want to thank Katarina, and I'm sorry, colleagues, who will speak next. Happy upcoming holidays. Thank you, Hanna. Also, I would like to comment, taking advantage of the opportunity, to comment on what you've said about the intervention is, about the importance. Well, of course, it's not just about his intervention, but all the others, that we have to implement our interventions, any interventions according to the requirements, and we have to have the trained specialists in the training. We cannot simply read the handbook of the intervention and start implementing it. It's important to understand, and it's something that we've managed to see within this interviewing organizations initiative. We heard from some of them that they implement these interventions without the full training. I also want to draw your attention to that because on the one hand, it's about psychological interventions, but it's also related to the product which we've just released as a technical working group itself. So it's so important that it should not be like that. We have to implement the interventions according to the recommendations, and we have to implement that after we receive the necessary trainings, necessary skills and certificates, because those who joined these trainings, they know that right now the requirements are really serious and the requirements to certification are very serious, and all of that is controlled for the services which are received within these interventions to be of high quality. This is the point I wanted to draw colleagues' attention to. And also, let me highlight that we have to comply with all these requirements. And still, we need to follow the rules which are in these tools and in Ukraine. Thank you for highlighting that. I don't know, Hanna, if you want to comment on that. Only I want to support what you've said. Thank you so much for joining us. Thank you for all the great work that the task team is doing. It's actually about a huge package of different tools that we keep on talking about, thinking about, and it just gets bigger. So the further, the more. Next year, we will have even more, and we'll do our absolute best to meet the need on these interventions and also help even more so that everything that's implemented would be of high quality and accessible, easy to understand, and compliant with the requirements. So thank you so much, Hanna, and thank you to the task team. And now let's move on. And let me tell you about one more task team. I'd like to give the floor to it so that we'd listen to the updates on mhGAP in Ukraine. I think you know well this initiative because it is the initiative that everyone talks about, and when people speak about the successful cooperation among partners, they always bring up this example. Now I'd like to give the floor to Maria so that she'd share the progress on mhGAP implementation this year, and we'll hear the priorities of this task team within this initiative. And please tell us about all the achievements, Maria. The floor is yours. Thank you, colleagues. Good to see everyone. Good to be here. This is the final meeting this year, and I want to say happy upcoming holidays. I'll try to be fast and share the updates and share our achievements. But at first, let me remind you a little bit and introduce you to mhGAP. This is Mental Health Gap Action Program, and this is the flagship program of the WHO, global program. Put it simply, the aim of this program is to make mental health services more accessible by engaging the primary health care workers to provide basic care for people with mental health disorders. In Ukraine, this program is being implemented from 2019, and for the coordination of the process, we created the mhGAP initiative. Maybe you've heard about it, and it includes right now 28 international international organizations, national organizations, and UN agencies. From 2020, all the stakeholders, partners, MOH, Coordination Center jointly agreed on one framework of mhGAP implementation in Ukraine. And within this framework, we conducted the trainings. I mean, all partners conduct trainings. Next slide, please. Here, let me share the statistics with you. We really like numbers, so we have something to brag about. From 2019 to 2025, more than 8,700 primary healthcare workers were trained, and among them, there are, like according to analytics of NHSU, it's almost 20% of primary healthcare contracted doctors who finished offline training, and 11.5% of level medical workers also finished offline trainings. From 2023, more than 1,100,000 people received mental health services from family doctors and nurses. And here you can see how the number of recordings in the e-health system from 2022, 23, and 24 increases. I think that next month we'll have a chance to see the statistics for 2025. Also, here you can see the statistics on the number of trained people by regions. The highest number is in Lvivska, Dnipropetrovska, and Odessa oblasts, and it's very nice that it's different parts of Ukraine, so we try to cover the whole country with partners, and the lowest coverage is in Luhansk and Kherson oblasts due to the temporary absence of control of these services and the access to the trainings. Next slide. I would like to share with you an important achievement. That is something we worked on for a long while in 2025. This is our dashboard. It is available following the link, and it is on the webpage of Response Relief. Feel free to find it there, and this dashboard is very convenient to use. You can see statistics, geographic coverage with trainings, and this dashboard is updated twice a day. I mean, the data is all up to date and relevant. You can see the number of partners conducting the trainings annually. And also, if you want to see your facility and see whether there is anyone there who finished the offline mhGAP training, you can also see that by filtering by healthcare facilities. You can write down the full name of the facility or EDRPOU. And also, soon we will add one more dashboard, but I will tell you about it next year. We're still working on it. So on the next slide, one more. I would like to say that the implementation of our program happens thanks to our partners and partner cooperation. And although the initiative right now includes 28 organizations and partners, the active participation changes depending on the capacity and the period of implementation. From the very beginning, 2019-2021, we had only 5 organizations providing the trainings. Over time, the number of organizations increased to 8, 15, then went down to 11, and right now we're very happy that in 2025 we managed to go up again, and right now in 2025 15 organizations provided the mhGAP trainings and supervisions, and we are really thankful to our partners. Here I'd like to highlight once again and say that right now we trained only 15% of the total number of primary healthcare workers at the offline training, so the need is still high. And on our end, we are open to engage new organizations to mhGAP initiative. If you have the resources and you're willing to run the trainings and join this initiative, we gladly welcome you and invite you. We will share all the materials, inform you about the one framework. So if you want to join us, please email us. I will leave my contact information, and of course, join our regular meetings where we share details about mhGAP implementation. Next Tuesday, we will have a meeting like that, December 23rd. So, next slide, please. I will leave the training form application for the training. If your colleagues or you want to have the training partners together with us regularly and conduct the trainings, and we collect all the forms for convenience. This form is for the primary healthcare workers, but you can also fill it in when we select the group. We choose different forms to find the participants. So here you can see the scan, the QR code for the application form. Here on this slide, I can tell you about a separate direction of our work. In 2025, this direction has become one of the main and important directions. That is mhGAP integration into the medical education system in Ukraine. And as of today, the Ministry of Health of Ukraine and the Coordination Center for Mental Health have identified 18 priority universities to implement mhGAP into curricula. The pilot implementation happened in Bohomolets National Medical University, and until September 2025, all the educators from 18 universities have finished the full training, as it included 3 stages, and the launch of the training process started from September 2025. So right now, students have already started studying mhGAP in their classes at the universities. So we are proud of that, and we want to thank our partners who trained our university colleagues, and thank you that you actively joined this direction. Next slide. Here I'd like to tell you a bit more about what we started in 2025. This is our trainer and supervisor community. Right now it has 732 trainers and supervisors, including our educators, and we managed and decided to create this community, this platform, to stay in touch so that we would support and strengthen trainer and supervisor potential capacity, strengthen social connections, rapidly exchange information, inform about the search of trainers and trainings, and provide the information about next trainings and the updates of the legislation and regulatory acts. It's an active platform where all the stakeholders can communicate, exchange information rapidly, and we are very proud of this initiative, of course. It has not just trainers and supervisors, but also all the partners who can quickly communicate with the trainers if needed. Next slide, please. So right now, without numbers, without statistics, let me just share the pictures from our important events. When I was making this presentation, I understood that November and December were so active because we had a few panel discussions, webinars, and I wanted to share the pictures from these events with you. In general, in November, all of you know that we had the third mental health forum, in which there was a panel discussion on sustainable development of competencies based on sustainable training approaches, where a case of mhGAP program was discussed, and there we discussed that effective training is not just about knowledge, it's about combination of practice, supervision, safe environment, and it's also important to include the staff care. And in this panel discussion, the speakers shared the real examples how mhGAP changes the attitude to mental health, reduces stigma, and helps healthcare workers to work better in the team. We want to thank all the speakers who joined that discussion. It was very, very friendly and nice event. Next slide. I also want to share the information that November 18th, we had a very important event. That is a webinar, experience sharing webinar on the mhGAP implementation in Ukraine. We did that in cooperation with MOH for Moldova, Georgia, and Hungary. Here you can see MOH representatives, Irina Matvichak, the family doctor of the professor shared the experience of program implementation, said about scaling up from the very beginning and how to work in the war times. And it was so valuable that the speakers shared the practical results on how training, supervisions, and partners healthcare workers provide mental health support and make it closer and accessible to the patient. In that webinar, we tried to create the space to exchange real experience and not just to show some presentations and numbers. So I hope we nailed it and managed to do it well. And the last slide for today from me. It's a recent event which happened in December. It was an open dialogue 3.0 nursing education in Ukraine, integration, quality, and harmonization. There was a panel discussion, competencies changing the system. There we discussed the role of the nurse and the impact of mhGAP program on the competence, teamwork of nurses, and the well-being of nurses. It was so valuable that speakers shared their experience on how the mhGAP training helps better work with uncertainty and more effectively cooperate with doctors and patients, and how mhGAP program improves quality of care provision. The key thought of this panel discussion was that it's important to integrate mhGAP program in the training of nurses in colleges and training not only at the universities but in colleges as well. So this is our plan for next year. And it was the last slide that I wanted to show you. So here, I would like to leave my contact information, and I want to express my sincere gratitude to all the partners for fruitful cooperation and the support of our mhGAP initiative. I also invite all the new partners to join mhGAP initiative, and jointly we can expand the access to mental health services. Let me leave the contact information of Daria Yurchik, Officer on Integrated Mental Health Services of the World Health Organization in Ukraine. If you have any questions or you want to discuss future cooperation, feel free to email us. And then again, I want to say to you, happy upcoming holidays. Re-energize yourself and rest more, and we'll be happy to see you next year. Thank you for your attention. Thank you, Maria. Actually, a lot of work has been done in the field of mhGAP program implementation. So this year has become a benchmark year because mhGAP was integrated in education. And in my opinion, that is a huge aspect, helping the sustainability and resilience. And the same thing can be said about psychological interventions and all the other points of our work, and the work of the technical working group itself on the national level, and the work of our task teams. And of course, it's important to mention all other task team, the task team on veterans work, task team on MHPSS in education, task team on mental health centers. So today I also wanted to give the floor to Alona, representing our task team on MHPSS in education. I know that there were some problems with the internet. Alona, can you hear us? Because we also want to give you the floor so that you'd have a chance to share your updates on the work of your task team, because there are some important updates related to the future of the group. Alona, over to you. I cannot see Alona. So probably her connection is not stable, but we'll hope that she'll manage to fix it. We understand that right now in these tough times, it's difficult to have meetings, especially online. But for now, let me highlight that this task team had its last meeting this week, and in the future, they do not plan to continue running the meetings because there are some changes in the structure of response in the education sector. But let's hope that Alona will manage to join us and maybe her deputy will share updates on that. So right now I'd like to sum up what we've discussed today and say about our next steps. So in January, we will have a meeting, January 29, dedicated to planning of work for 2026. We will discuss all the needs, trainings and topics we have to discuss, how we have to improve our work, what we need to continue implementing. That's already been implemented. But right now, I would like to briefly outline our key priorities, key strategic directions, and what we will continue working on. And of course, first of all, we'll focus on strengthening the national effort. I mean, here, not just the coordination, but the efforts of different ministries in the implementation of priority projects in mental health, strengthening the structures which were implemented in Ukraine, strengthening different legislative initiatives, and so on. Apart from that, plan to continue strengthening the coordination because coordination continues being a key direction and priority direction as the technical working group. We will continue fostering the coordination so that it would be aligned with everyone and so that our work would be implemented on high quality level and so that all the members and stakeholders of our technical working group and stakeholders in MHPSS area in Ukraine so that they would be informed about all the needs, achievements, gaps, and trends that are there in Ukraine at this period of time. And of course, we will build our response and activities based on the national vision, the structures implemented by Ukraine, and innovations that we have. There are so many of them over the last years. We partly mentioned them, and we will continue responding to the emergency and strengthening Ukraine's mental health system in broader terms of this, not just in the health sector, but also out of the health sector. So we do hope that this year the technical working group was helpful for you, that our activities that we mentioned today, they met your needs and requirements. So next year, we hope that we will support you even more and will provide you with even more trainings and opportunities, and we will help the sustainability of our response and our work. So, thank you so much for your attention. Happy upcoming holidays. See you next year in 2026. We will start from the discussion of our plans and priorities for 2026, and together we will make our action plan, set objectives and goals, and all 2026 will work hard to implement everything. So thank you so much. Take care and contact us if you need us. We are always here for you. Thank you and goodbye.
Дякуємо, до побачення.
Thank you. Goodbye.